You just got your latest lab results back. Your doctor's office sent them through the patient portal, or maybe you got a call. Nothing urgent, but there it was. eGFR, creatinine, urine albumin. Numbers you've probably seen before, but this time, one of them changed. It went down. You stare at the result. Is this bad? Should you be worried? Does it mean kidney disease? Or is this normal for your age? Your mind does what it does. You start to catastrophize. You imagine dialysis chairs. You wonder if you should have drunk less coffee, eaten differently, taken better care of yourself. But here's the thing. You have no idea what that number actually means. Your doctor's office only gave you 30 seconds over the phone. Your doctor's office only gave you 30 seconds over the phone. Your doctor's office only gave you 30 seconds over the phone. Your mind does what it does. You start to catastrophize. You imagine James Chen, and on Health Insights MD, we break down confusing medical results into clarity. Today, I'm going to walk you through exactly how to read your kidney lab results, what the numbers really tell you, why trends matter more than one isolated number, and how to have a smarter conversation with your doctor the next time you sit down together. By the end of this video, you won't just know what your results mean, you'll understand why these tests matter, which results actually deserve your attention, and what questions to ask next. Let's get into it. Let me start with something you probably already know, but it's worth saying out loud. After 60, your body changes. Your metabolism shifts, which results actually deserve your attention. And what questions to ask next? Let's get into it. Your kidneys aren't as efficient as they were at 30, your heart works a little differently, your blood pressure rises. These aren't failures, they're normal aging. But normal aging doesn't mean you should ignore what's happening. Here's where it gets confusing. Most people get a lab report with 7, 8, 9 different numbers related to kidney health, and they focus on one, eGFR. That's the one everyone talks about. It's the one your doctor probably emphasized. It's the one you obsess over. But here's the truth most patients don't realize. eGFR is important. Let me tell you why people get so worried. The eGFR scale is counterintuitive. Unlike most lab values where high is good, lower eGFR means lower kidney function. So when your doctor says normal eGFR is above 60, or your eGFR is 52, your brain immediately computes, I'm below normal, I have a problem. And that's where fear takes over. But here's what they don't always explain. eGFR varies. It fluctuates with hydration, with activity, with time of day, with medications, with kidney stress. An isolated low result doesn't prove anything. It raises a question. And that's, you get your eGFR, you check which stage you're in, and then you assume that's your destiny. Linear progression, downhill from here. But that's not how kidney disease actually works for most people. The National Kidney Foundation classifies kidney function by these stages. Stage 1, eGFR 90 or higher, normal kidney function, but kidney disease might still be present if there's protein in the urine or structural damage. Stage 2, eGFR 60 to 89, mildly to moderately decreased kidney function. Again, kidney disease might be present. Stage 3A, eGFR 45 to 59, mildly to moderately decreased kidney function. Stage 5, eGFR below 15, kidney failure, often requiring dialysis. Now, here's what most people assume. If you're in stage 3A, you're on your way to stage 5. Inevitable decline. That's wrong. In reality, many people stay in stage 3A or 3B for years, even decades, without ever progressing further. Some improve, some stay stable, and here's the critical part. How fast your kidney function declines depends on why your kidneys are declining. Your doctor has seen hundreds of patients in stage 3. Most of them live long, full lives with stage 3 kidneys. The stage classification tells you something important, but it doesn't tell you your personal story. Let me walk you through a realistic scenario, and this will help everything click into place. Robert is a 68-year-old man. He's got high blood pressure, controlled with medication, and he's a little overweight. Last year, his labs looked like this. eGFR, 58 creatinine, 15 urine albumin, trace amounts, blood pressure, 145/88. Robert saw that eGFR of 58, and his first thought was, I have kidney disease. I'm in stage 3. I'm getting worse. And here's where he made the classic mistake. He focused only on the eGFR. He didn't look at the pattern. He didn't ask the right questions. He didn't contact his doctor. 3 weeks later, Robert got sick. Not kidney sick, he got a urinary tract infection. It was treated with antibiotics. His blood pressure had been creeping up, which his doctor had been meaning to talk about, but they hadn't adjusted his medications yet. He'd also started taking a supplement for his joint pain, an anti-inflammatory that can affect kidney function. Here's the point. Robert's kidney function did decline, but it didn't decline because his kidneys are failing. It declined because there were modifiable factors acting on his kidneys: the supplement, the rising blood pressure, the infection stress. Now, fast forward 6 months after his doctor made changes, stopped the supplement, adjusted his blood pressure medication, monitored him more closely. His latest eGFR, 62, creatinine, 1.05, urine albumin negative again. His decline had stopped. Some function returned. Not because he was cured, but because it's a snapshot of today. The trend over time, combined with the cause of any decline, tells you whether this is something to worry about or something to manage. Here's where I want to pause and ask you a question, and I want you to actually think about this. When you look at your lab report, what are you actually looking at? Most people see numbers, but what you're really looking at is a snapshot of kidney function at one moment in time, influenced by dozens of variables. Your hydration level that day, eGFR, specifically is an estimate. It's not a direct measurement. It's a calculation based on your creatinine level, which is a waste product your kidneys filter, and your age, sex, and race. That's it. No single creatinine value means you have kidney disease. No single eGFR is a diagnosis. So here's what I want you to do. Stop thinking about your results as a test you pass or fail. Start thinking about them as a conversation between you and your kidneys. Your kidneys are telling you something. They're not saying, "I'm broken." They might be saying, "I'm a little tired today," or "something is stressing me," or "pay attention to what you're eating," or "your blood pressure is getting too high." That's very different from a diagnosis of kidney disease. Most people think kidney disease means something is permanently wrong, but here's the clinical reality. Chronic kidney disease, or CKD, is simply defined as kidney function below a certain threshold for more than 3 months. It doesn't mean your kidneys are damaged. It doesn't mean it's progressive. It means your kidney function is lower than expected, and we're going to keep an eye on it. In fact, many people have CKD and never know it because they never get tested. Think about that for a second. You could have stage 3 CKD and live a completely normal life, never progress to stage 4, and die at age 90 of something completely unrelated to your kidneys. Now let's talk about how these tests actually work together. Because here's what your doctor looks at. Not just one number, but the relationship between several numbers. eGFR and creatinine. eGFR is calculated from creatinine. So when your creatinine goes up, your eGFR goes down. They move together. But creatinine can change for reasons other than kidney function. Muscle mass, diet, medications, even time of day. A 75-year-old man with low muscle mass might have a creatinine of 1.0, perfectly healthy kidneys. A muscular 50-year-old man might have a creatinine of 1.3, with healthy kidneys too. This is why age, sex, and race are built into the eGFR calculation. Muscular 50, but even so, if you see your creatinine trending upward over multiple visits, that's worth paying attention to. It means either kidney function is declining or something is temporarily stressing the kidneys. Urine albumin, or protein. Here's a test most people don't fully understand. Urine protein. Normally, your kidneys filter waste and water, but keep useful things in your blood. Protein is useful, so healthy kidneys should not let significant amounts of protein into your urine. If they do, it means the filtration system is leaking, and that's actually a more specific sign of kidney trouble than eGFR alone. If your eGFR is 65 but your urine is clean, no protein. If your eGFR is 75 but you have protein in your urine, your doctor is more concerned, because protein in the urine tells you the filtering structure itself is damaged. This is why your doctor always checks this. It's not a side test. It's central to understanding what's happening. Blood pressure. This isn't technically a lab test, but it belongs right here in this conversation. High blood pressure damages kidneys. Damaged kidneys raise blood pressure. It's a vicious cycle, so when your results come back, your doctor is connecting the dots. What's your blood pressure? Is it controlled? Has it changed? If your eGFR is declining and your blood pressure is rising, the cause is probably clear, and the solution is probably clear too: better blood pressure control. If your eGFR is declining and you have protein in your urine and you have diabetes, your doctor knows this is likely diabetic kidney disease, and that changes the treatment plan, the trend. Here's the single most important thing I want you to understand. One result means almost nothing. 3 results mean everything. Your first eGFR, 1 year later, 62. That's a pattern. You're losing about 3 to 5 points per year. That's information. Is it fast? For someone your age, it's actually fairly typical, especially if you have high blood pressure or diabetes. But if your results looked like this: your first eGFR, 71. Your second eGFR 6 months later, 65. Your third eGFR 1 year later, 59. Now you're losing about 6 points per year. That's faster. That's the kind of pattern that makes a nephrologist pay closer attention. They'll want to know, did anything change? New medication, started exercising. Step 1. Get a second result. Don't base any major health decisions on a single lab result, especially if it surprised you. Ask your doctor to repeat the test in 4 to 6 weeks. Kidney function fluctuates. You might have been slightly dehydrated. You might have had a mild infection. The repeat result will tell you if this is a trend or a blip. Step 2. Know your numbers. Write down, don't just remember, your eGFR, creatinine, and urine protein results over time. Make a simple chart, see the pattern, this is your data, own it. Step 3. Ask these specific questions at your next appointment. Don't ask, is my kidney disease going to get worse? Ask instead, is my kidney function stable, improving, or declining? Step 3. Ask these specific questions at your next appointment. Don't ask, is my kidney disease going to get worse? Ask instead, is my kidney function stable, improving, or declining? Step 3. What is causing the change, if any? Do I have protein in my urine? Is my blood pressure at target? Are there any medications I'm taking that might affect my kidneys? Should I see a nephrologist? What changes? Diet, exercise, medication would help my kidneys most right now. These questions push your doctor to explain the story, not just the number. Step 4. Understand your baseline. Your baseline is what healthy kidney function looks like for you. If your eGFR has been 60 decline, that deserves explanation. If your eGFR has been 60 to 65 for 5 years, then 62 is a step 5. Take action on what you can control. Here's what actually does slow kidney disease, and there's no secret here. Control your blood pressure. This is the single biggest modifiable factor. If your blood pressure is 150/95, getting it down to 130/80 can genuinely slow kidney decline. Control blood sugar if you have diabetes. Consistently high blood sugar damages kidneys over time. Reduce sodium. Most people eat way too much salt. Your kidneys have to work harder. Be careful with supplements and over-the-counter pain relievers. NSAIDs like ibuprofen and naproxen can stress kidneys, especially if you already have compromised function. Monitor your weight. Obesity stresses the kidneys. Losing weight if you need to actually improves kidney function. Get infections treated promptly. Urinary tract infections and other infections can temporarily decrease kidney function. Talk to your doctor about medications. Some blood pressure medications actually protect kidneys. Some don't. There's no quick fix, but small, consistent changes absolutely matter. Let's come full circle to where we started. You got your lab results back. One number changed, and instead of panic or confusion, you now understand what you're actually looking at. You have a snapshot of your kidney function today, not a diagnosis of doom, not a guarantee of the future, a data point. And if that data point is lower than you'd like, you have a plan. Get another result, understand the pattern, ask smart questions, and take action on what you can control. Most people over 60 will experience some decline in kidney function. Most will be completely fine. Almost all of them, the vast majority, will never need dialysis. They'll die of something else entirely. Your kidney labs are important, your doctor is right to check them, but one number doesn't define your future. Your awareness, your willingness to ask questions, and your commitment to the basics, blood pressure, blood sugar, hydration, activity, those things define your future. If you're still confused about any part of your results, that's okay. Kidney labs are confusing their results a little better. I genuinely love to know what part clicked for you. Leave a comment and tell me which test you were most confused about or what number worried you most. Don't share sensitive medical info, but let me know what would help you understand your health better. Your comments help me create videos that actually answer the questions people are asking. If you found this useful, please subscribe. We're creating health education videos every week about kidney disease, diabetes, heart health, and just about everything else that affects adults over 60. We make this content because too many people feel confused and scared by their lab results.